Your retina is a thin layer of tissue in the back of the eye that holds the key to diagnosing most blinding diseases. Its appearance can indicate the presence of conditions like macular degeneration, diabetic retinopathy, and glaucoma. But it wasn't until the advent of a technology called optical coherence tomography, or OCT, in the 1990s that objectively reviewing the retina was even possible.
So what were people using before OCT?
They were looking. They were looking at the back of the eye and making a subjective assessment of what it looks like. And that was how we did it up until the mid-90s.
Dr. Joel Schuman is a professor and the chairman of ophthalmology at NYU Langone Health. He was part of the team that invented optical coherence tomography.
It is a way of making a three-dimensional map of the back of the eye. In this case, we're talking about eyes, and it can see the retina, which is the nerve tissue in the back of the eye. It's sort of like an ultrasound, but using light instead of sound waves. So what that does is it allows us to diagnose disease much earlier than we ever could before, and to follow treatment of disease. So is my treatment working or not? Is somebody getting worse or not? The first time the patient comes in, you know, or you can figure out, does this patient have some sort of disease? And all of these things can be measured very accurately and precisely with OCT.
Dr. Schuman says ophthalmology before OCT was similar to neurology before the advent of CT scans or MRIs, when neurologists would have to make judgment calls on where in the nervous system an abnormality originated.
What OCT does, and one of the reasons that I was interested in being involved in inventing OCT, is that it allows us to take the subjectivity out of the assessment of eye disease and out of the question of whether or not somebody is getting worse. We can actually measure the tissue. It's done objectively, quantitatively, and it is non-contact and non-invasive and very quick.
Now, decades after OCT first changed the field, Schuman is researching ways to use the technology as a foundation for new innovations in eye treatment.
In terms of where OCT is now, we're able to measure structures in the eye. But where we're going is being able to measure how the tissue is working. The nerve tissue that's in the back of the eye, the retina, is part of the brain. And the brain doesn't regenerate. Because it doesn't regenerate, damage to the retina is really serious because the retina doesn't get better. Now, we are doing experiments here to try to restore function to retina that's been damaged. And we're excited about that.
Schuman's team is looking into utilizing different wavelengths of light to determine how much oxygen is getting into the tissue. And they're using a technology called adaptive optics to actually see cells damaged by glaucoma. The team is also collaborating with IBM to develop artificial intelligence capable of predicting the trajectory of a disease based on patients' OCT images.
What we're working on is using deep learning to analyze OCT images and also visual fields to determine whether or not somebody is likely to get worse or not, and also to analyze that image itself. So kind of an automated way where the machine could do the reading.
The team provides IBM with de-identified data, keeping patients anonymous, and IBM works on developing machine learning.
And so that collaboration brings these different skill sets together in order to create a greater whole, which is algorithms, these ways of analyzing OCT, analyzing visual fields, putting everything together, and being able to say, okay, this patient has disease, this patient doesn't, this patient is going to get worse quickly, you better act. This patient's going to get worse slowly, maybe you don't need to see them that often or treat that aggressively.
Schuman says some of NYU Langone Health's current research on eye treatment is, quote-unquote, a little far out. Experiments that very well could fail, but evidence suggests could be successful.
And one of the things that we're doing like that is a gentle electrical stimulation in order to restore vision. And specifically, we're looking at this in people with glaucoma.
Have you had any changes in your health or glaucoma treatment regimen?
No.
Associate Research Scientist Dr. Heather Livengood heads up this study at NYU Langone Health, collaborating with a colleague in Germany. Today, she's meeting with patient Kurt Macumber, a professional violinist diagnosed with glaucoma.
We're doing an experimental intervention that's called repetitive transorbital alternating current stimulation, and we call that RTACS for short. We use a low electrical current, and we place 2 electrodes, one above each eyebrow, and we deliver stimulation over 10 days for 30 to 45 minutes. We're trying to mimic that natural process of how the cells communicate from the eye to the brain by using this electrical stimulation. And the idea is for those cells in the eyes, in the retina, that aren't working to their full capacity, we want to see if we provide this external stimulation, will we help them to function a little bit better, more effectively, more efficiently, so that communication, the information they send back to the brain may be improved so that people may ultimately perceive an improvement in their vision.
OCT imaging will allow Dr. Livengood to determine whether the stimulation is working or not. She says the experimental medical intervention won't change the mechanism of glaucoma, but that it may help slow the progression of the disease. That's the outcome that Macumber, Livengood, Schumann, and the team are hoping for.
I certainly hope that after these sessions are over, that I will notice some improvement in my vision. I understand that that may not happen, but I'd like to see if it may.
Research is often exciting. It often doesn't work. But I've been lucky to be in several studies that have looked at new things that actually do work.
Like optical coherence tomography. And while NYU Langone Health's experimental treatments are still in the early stages of research, one of them could be the next big breakthrough in eye care. In Manhattan, I'm Maddie Orton for Metro Focus.